Hello, beautiful moms. Hope you're all fine and your babies are also doing well. So, having tough time nursing your baby? I know there are so many issues related to breastfeeding and you need to address all of them. So, today in this video, I'm going to share some tips to resolve all your issues. In my previous video, I shared some basics related to breastfeeding that you should be aware of. So, if you want to watch such more videos related to pregnancy, mother care, or childcare, please subscribe to my channel. And let's now move ahead to this video. Very first and common issue is lumps in your breast. Well, please keep an eye on your breast if you are developing any kind of lumps. Sometimes what happens while breastfeeding, some of the milk ducts in the breast get blocked due to milk. And so it may cause some small, painful, hard lumps. So you have to keep an eye on these lumps and treat them on time. Otherwise, it may cause more issues in the future. So, what you can do to avoid and treat these lumps? Make sure you don't miss the feedings. Hold your baby in right position while breastfeeding so that it is latched properly to be able to empty the breast. Express milk between two feedings if necessary. Use warm compress on the breast. Massage towards nipple before breastfeeding. Second, very common issue related to breastfeeding is cracked or sore nipple. So, main cause of this is improper latching of the baby to your breast. So, you have to make sure your baby is latching properly and you are using proper techniques for latching your baby. You can go and watch my previous video related to basics of breastfeeding to know how to make your baby latch properly. So, improper position of your baby can be one of the cause for cracked or sore nipples. So, there are things that you can do to avoid and treat your cracked or sore nipples. Let's see what are these. When nursing, start with the least painful side since your baby is likely to suck most vigorously early in the feeding. At the end of the feeding, apply some fresh breast milk on your nipples to soothe them. Human breast milk has antibacterial properties, so it can reduce the chance of infection. If you're still in pain, talk to your doctor about using a cream or vitamin E on your nipples. Third, very common issue related to breastfeeding is a baby is refusing to breastfeed. Well, it often happens that babies refuse to breastfeed and we don't understand the reason why they are doing like this. So there are multiple reasons why this happens. Very first reason is nipple confusion. Well, if you introduce a pacifier or a bottle very early to your baby, then babies get confused between original nipple and artificial nipple. And because they have to apply less energy and suck less using artificial nipple, they are actually getting used to the artificial nipple. That's why you should not introduce artificial nipple or pacifier or a bottle very early to your baby. Well, in some cases, when you are not able to breastfeed your baby very immediately after birth, that happens very commonly. So, initially, you may have to introduce a bottle to your baby, but don't make it a habit. So, try and breastfeed your baby as much as possible rather than giving a bottle to your baby very early after delivery. So I'm also going to make a video on how and when to introduce a bottle to your baby. Please keep watching my videos on my channel. The second reason why babies refuse to breastfeed can be because of change in scent or taste. Well, this may happen because if you use or change your deodorant, your moisturizer, your daily soap, or even the soap that you're using to wash your clothes. So, it is recommended not to use very strong scented moisturizers, deodorants, or perfumes. Use mild ones. The other thing can be because of the change in the breast milk taste that may trigger because of the food that you are consuming, the medications, or your periods, or if you are getting pregnant again. This may cause a change in the taste of your breast milk. To avoid this, keep an eye on whatever you are eating, and if that is causing any kind of behavioral change in your baby or a breastfeeding strike in your baby. And always take medicines after consulting a doctor. that has to be safe for lactation. The third reason why babies can refuse to breastfeed is just because of their mood. I know sometimes it happens that babies actually refuse to breast milk without any particular reason. So in this case, what you can do is try and calm your baby. Take your baby to a dark or quiet place, or play some soft music, or just go with the flow. This used to happen with me a lot of time. My baby used to refuse to breastfeed from one of the side every now and then. And if I used to offer her breast milk from other side, she used to take her feed without any complaints. So when I consulted a doctor and a lactation expert and asked her why is this issue arriving every now and then, the answer that I got was there is no particular issue and it is just baby's preferences. So sometimes you just have to go with the flow. Fourth issue for breastfeeding that I consider is breastfeeding your baby in public places. So nowadays, when families are becoming nuclear and very soon after delivering a baby, most mothers have to be independent and go out for their regular things. It can be an issue to breastfeed your baby on the public places. So, what you have to do and what things you need to prepare before you leave your house with your baby are as follows. Look for the breastfeeding rooms at the stores or malls that you go. If you are at a place where nursing rooms are not available, be always prepared and carry a good cotton nursing cover or a simple blanket to cover yourself and your baby properly. Try to go out in a time between two nursing sessions. Wait until you and your baby gets used to the some breastfeeding techniques. Well, that's all for today. I hope that helps. I would like to clarify that I am not a doctor or lactation expert. I am just sharing my experiences with you. I hope that helps. So wait for my other video. Till then, bye.